Health Canada must reject the proposed Henry location for the drug injection site proposed by this NDP government. It's clearly laid out that the NDP do not have a plan. There is no baseline data from which they are referring to. They're under the auspice of an emergency need for this, and yet they don't have the data. They will not provide a plan. They have not talked about financials or staffing or emergency situations. It's literally like they're just making them up as they go because they think this is a win for them, and they think that the residents of Point Douglas and this area here won't say anything. Well, they are. And they're speaking loud and clear. If you went to any of those meetings, it was unanimous in the room that anybody that lived there or had a business there doesn't want it. I have yet to see a business come forward in this area that says we want this in our backyard. If the Premier wants this so badly, then why won't he put it in his riding? Let him put it in Fort Rouge. Let him put it in Tuxedo or Waverly or Lagimodiere. We have said that as a party and as a community, as a society, that we want to help people. We want to get people wraparound support. We want to get them off of drugs. We want to help them of where they're at in their life, not provide them a place to consume drugs. So fundamentally, we are against the concept of having a drug consumption site. We want wraparound supports. We want help for Manitobans when they need them. If any of our loved ones were going through this, whether it be drug addictions or alcoholism, we would offer them support. We wouldn't give them more alcohol. We wouldn't give them more drugs. So why is it okay for Wab Kinew and the NDP to force a drug consumption site and this location at 366 Henry when the residents don't want it? When the businesses don't want it. So as a leader of the party, we are going to proudly take this forward and say the NDP need to stop, do the right thing, the compassionate thing, and that is to help Manitobans.
How can we play with people's lives and business, as well as the people that are suffering from this drug addiction? We need to do better. The NDP government is trying to shove this building without any data or anything to support this. What we need is wraparound services. We need to help these people to get off these drugs. We need the Justice Minister to be going to Ottawa and saying, why are these people that are supplying drugs not being treated like murderers? We need to help this location and this neighborhood here that many people I've heard have lived here for 30, 40, 50 years. Now they struggle to get home insurance. They struggle to get business insurance. And they're worried about their kids. So again, this is not the thing to do. I will ask one question. Would you give a drowning man a glass of water? The way to help this is with a hand up, not a needle in someone's arm.
Hi, Joseph Forey. I am founder of the Singing Red Bear Foundation and grew up in Point Douglas. And I want to answer that question. You know, what's going to happen here? I'm 7 years in recovery, had a very serious heroin addiction. And in Edmonton, I lived my life around a consumption site. And what happened in that area was not too long after that, trap houses are built up. Drug dealers are coming in because they know, as a drug addict, I know that I can buy my drugs here and then I can use my drugs here. That is what's going to happen here. I can say without a doubt that will happen here. Now, there'll be statistics that say that counteract that, but with lived experience, I know what's going to happen here. I lost my son in 2023 to a fentanyl poisoning. He wasn't a drug addict. He made a bad choice, consumed some recreational drugs believed to be fentanyl, poisoned with fentanyl, and he died. What we have in Manitoba right now is a fentanyl crisis, a drug crisis, not an addiction crisis. And we need to start addressing that. And that's not going to be addressed by putting a consumption site here. You know, and the more that this government puts this crisis on addiction, the more that it tells the recreational user, the weekend user, that their drugs are safe. Per capita right now, the highest death rate per capita in Manitoba is in the Norman region, in northern Manitoba. And they receive the least amount of resources as far as naloxone and any other kind of things like that. I make it my business because I don't want this to happen to another family, another young child, another young person. I know what it's like living with addiction. I've recovered. Winnipeg, Manitoba does not need this. I stand with Obby, I stand with Jeff, and I stand with the community of Point Douglas and saying enough is enough of having us be the dumping ground for these things.
Yes. Yes.
You know, we need to build this community up back to where it was. I remember Selkirk Avenue being a thriving community with businesses and Retzky's and the restaurants. We need to get back to that. We need to let these people know that they can be safe in their own communities, not have to fear what's coming down the pipe if this thing comes up. Because I was sitting in that restaurant and I was looking out that window and I was thinking, if this thing opens up, what are they going to look at? People are going to be lined up. When I asked Aboriginal Health, what's going to be the capacity? Well, under Canada Health policies, you can only supervise 6 people with 1 nurse. So you're going to have 6, how many nurses are you going to have? Well, I don't know. Where the nurse is going to come from? I don't know. Is it going to be 18, 3 nurses? What are they going to do with the people that are going to be waiting outside to access? How long are they going to stay? You know what they said? It's going to be like a lounge. They can do the drugs and then they can enjoy their high and then they leave. Well, how long is that going to take? They have no plan. And to be able to just force this on our people is wrong. So I stand with them and anything that they need me to do and say, I will say it. We need a recovery plan in Manitoba.
Yes.
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 We need prevention and awareness for our youth so that they know that the drugs that are out there right now are dangerous. We need a balanced approach. We need enforcement. We need treatment. We need prevention and awareness. Harm reduction, yes, plays a role in it, but it's not the end all and be all. If we're going to get ourselves out of this, then it's going to be the people like people of Point Douglas and the business community that all come together and say, okay, we're going to be part of the solution. I stand here, I want to be part of the solution. For most of my life, I was part of the problem. But in my recovery, I realized that there's more to life and I want to be able to help others and I want to help the community of Point Douglas be the community that I know they can be. Thank you so much.
I've been living in this community for close to 36 years. I raise kids in this community who are proud members of the Canadian Armed Forces today. The only thing Minister Bernadette have done so far for me is bring me Bannock at the legislative building when I was protesting there. The Bannock was very good. However, we not need this here. They lied to us in every aspect of this process. This is not just the core area. This is a place where kids grow, go to school, and work. We are a solid community, and we're going to stand for it. And they not expect that.
Hello everyone, my name is Kelly Miranda. I hosted the recent community town hall on the proposed supervised consumption site at 366 Henry Avenue so residents and businesses could ask questions and have their concerns heard. At that meeting, Minister Smith stated that the province has an obligation to collect community concerns and submit them to Health Canada as part of a consultation. We are now hearing from Health Canada that the consultation is not required. These statements directly contradict each other. If consultations matters, we need transparency about how concerns are handled. If it doesn't, we deserve honesty. Right now, the messages don't align, and our community deserves answers, especially as the local businesses are already facing increased security costs and past experience with the concentration of services shows conditions often worsens rather than improve.
I am the Executive Director of Winnipeg Inner City Missions. We have been working extremely hard for the last 3 years to develop our campus, which is on Logan, situated between Ellen and Laura. We have a 20-suite apartment building that has been providing for the last 17 years, second stage sober living. And we are in consultation and have grant funding that we are exploring to put an addition on that building. Adjacent to our building is also a large green space, which is a commemorative art garden that acknowledges residential and day schools and victims of the 60s scoop. It is a place of gathering and learning. Adjacent to that space is a building at 287 Laura. We have been working for exactly 3 years to invest $1 million in renovations to that space to create an Indigenous Arts and Cultural Center that was identified as a need in this community. We've been providing to children in the inner city for over 30 years an after-school program, and this is going to be the destination location for children from Ecole, Victoria Albert School, and from Dufferin School, from King Edward School, from McCrae School, and from Nichimakwa schools. We have a bus and we are picking them up and they are coming to this destination. We have our occupancy permit and we are ready to launch. We are within the 250-meter parameter that was identified by Premier Kinew when they were trying to put this center next to the school at Argyle. It's unacceptable. You can go to the City of Winnipeg zoning and bylaw section, and you will see that we have been designated as a community center for youth programming and daycare. So there are many situations here that we are all confronted with respect to this center, but at the heart of the matter is the Premier himself has set these parameters and limitations and restrictions on where it can go, and we are being overlooked, and our children are going to suffer. I have got letters contained in my package I'm happy to share with you that come from the two principals at Ecole Victoria Albert School and Dufferin, and also a letter from a prominent, long-standing member, civil servant, Clayton Sandy, who all agree that they are going to have great reservations about the children coming to this location because of this proximity of the safe consumption site. Our children in Centennial neighborhood have nothing. Their splash pad was torn down years ago, and they built the Housing First model, which is Home First Winnipeg, and now the children have to be walked to school because of the consumption that is happening in front of that Housing First building. This is about our children, it's about their safety, and we need to hold the Premier accountable for the parameters that he has put in place.